I'm Francisca, D3 nursing student at Politeknik Kupang. Today, I will explain a little about the concept of family planning and reproductive system disorder. Let's study together. First, let's find out what family planning is. Family planning is one of the efforts to achieve property by providing marriage advice, infertility treatment, and birth spacing. Family planning is an act of helping individuals of married couple to avoid unwanted birth, get the birth they want, regulate the interval between birth. Family planning is a consequent process by couples to decide the number of spacing of children and the time of birth. Next, what are the goals of family planning? The purpose of family planning is to improve the welfare of mother and children and to create happy and prosperous small family through birth control and controlling population growth in Indonesia. In addition, family planning is expected to produce quality resident, quality human resource, and improve family welfare. Next, target family planning. The target of the family planning program include direct target, i.e. couples of childbearing age who aim to reduce the birth rate by means of sustainable use the contraception, and indirect target consisting of family planning, implementary and managed by reducing the birth rate through the integrated population policy in this order to achieve quality family and prosperous. Next, what is the scope of family planning? The scope of the family planning program includes communication of information and education, counseling, infertility service, sex education, premarital consultation and marriage consultation, and genetic consultation. Next topic about disorder of the reproductive system. First, syphilis. Syphilis is an infection disease caused by a spiral-shaped bacterium called Treponema pallidum. This disease can attack various organs in the body, can be transmitted through intimate sexual or physical intercourse, through microscopic word, fresh blood transfusion, and from mother to fetus through the placenta. Next is gonorrhea. Gonorrhea is an acute infection disease that attacks the mucous membrane of the urethra, cervix, sometimes in the rectum, pharynx, and eyes. This disease is caused by the bacterium Neisseria gonorrhea, a gram-negative diplococcus. The incubation period is 2 to 40 days. The symptoms are pain when urinating and yellow-green pus come out of the urethra. In women, there are often no visible symptom or symptom of urinary pain and yellow-green vaginal discharge. Inflammation and blockage of the fallopian tubes by gonorrhea often cause women to become infertile. During delivery, the bacteria can be transmitted to the newborn eyes and cause blindness. Giving 1% silver or antibiotic liquid to the eye can prevent eye inflammation in babies. Treatment using various antibiotics. In the next, HIV and AIDS. Most cases of HIV in women are obtained from direct contact during sexual intercourse with a partner. Not only that, sharing needle with infected people is also a medium of HIV transmission. Finding the true triggers is also a way to prevent the transmission of HIV and AIDS. Thanks to advances in modern medicine, HIV can be treated like any other chronic disease. Not a few people with HIV whose quality of life remain good and even have offspring. With special infertility treatment, the chance of passing the virus on the baby are quite low. Next is Prostatitis. Prostatitis is inflammation of the prostate which is often accompanied by inflammation of the urethra. Symptoms include swelling that can block the urethra, causing pain and difficult urinating. Chronic urethral obstruction can be cause obstruction, infection, and damage to bladder and kidney. Next is cervical cancer. Cervical cancer, this type of cancer also occurred in many women and often causes death if only discovered after advanced phase. Cervical cancer can be found early using the pap smear technique, which is a way of taking cervical tissue and examining it under a microscope. This check can be done every year. This type of cervical cancer is mostly found in women aged 40 to 50 years, and the incidence of this cancer is thought to be closely related to infection with herpes virus type 2 and human papillomavirus. Treatment with surgery, radioactive, and drugs. The next, endometriosis. Endometriosis is the presence of abnormal endometrial tissue outside the urine cavity. These abnormal endometrial tissues can be found in the ovaries, peritoneum, colon, bladder as a result of black flow of menstrual blood through the fallopian tubes during menstruation. Symptoms include menstrual pain because the endometriosis tissue will be set with menstruation. Endometriosis is often accompanied by infertility. Treatment is usually carried out by surgery or with the use of progesterone hormone. That's my brief explanation. Thanks for listening. I hope it will be useful for all viewers. See you on the next video.